Welcome everyone to the Iowa Hunger Coalition's September 2025 monthly meetup. My name is Luke Elzinga. I'm the Policy and Advocacy Manager at the DMARC Food Pantry Network in Des Moines, and also serve as the board chair of the Iowa Hunger Coalition. We host these meetups every month, third Wednesday of the month at 10 a.m. It's primarily policy updates. We also try to have some conversation and sharing, which we'll have some more discussion today. If you're not familiar with the Iowa Hunger Coalition, we are a membership-based 501c4 organization. We have a volunteer board of directors, no paid staff members, but we do have a contract lobbyist. We contract lobby with John and Cindy Peterson through Peterson Consulting. We have individual members, we have organizational members. We have a lot of folks who, join and are part of our network that aren't necessarily paid members, and that's perfectly fine too. But we really try to be that organization bringing together individuals, organizations to address food insecurity and build equitable food systems in Iowa through education, advocacy, and policy change. And we work with a lot of other partners outside of our coalition as well to do that. These are our mission. This is our mission and guiding principles. These were all developed by our members last year. And so our mission is working to end hunger in Iowa through education, advocacy, and policy change rooted in justice. And our guiding principles are hunger is a policy choice, nutritious food is a human right, and ending hunger requires solidarity, not just charity. And if you want to learn more about any of those guiding principles, just visit iowahungercoalition.org. It's right there on our homepage. All right, so today we're going to kind of focus on some federal advocacy updates related to the reconciliation bill that was passed and signed into law in July, and some of the implementation pieces, which you will learn we still have some question marks about, but we do know a little bit more. First, a reminder, all these cuts we're going to be talking about are the result of the One Big Beautiful Bill, the Reconciliation Bill, HR 1, all different names for the same thing. And this bill contained $187 billion in cuts to SNAP over the next decade. And that is the largest cut to SNAP in the history of the program, both in total dollar amount and by percentage of total funding. And all of Iowa's federal delegation voted in favor of this. And also wanted just to provide a few notes there if you haven't been following political news in Iowa. Senator Joni Ernst has announced that she is not seeking re-election. And Ashley Hinson, who is the representative for the second district, has announced that she's going to be running for the Senate. So we'll have a more contested race there. And then Randy Feenstra from the fourth district has not yet officially announced he's running for governor, but has very much indicated that he is planning to do so. So just wanted to note that. I mean, even if folks are running for different offices, they voted for this and it has an impact. And we want to hold our elected officials accountable for their votes and the impacts of those votes. Okay, so I kind of alluded to this already. We have some updates from USDA Food and Nutrition Service, that's FNS, and the Iowa Department of Health and Human Services on when these changes will be coming. Still some question marks. If you want to look more at the official guidance and documents, USDA has kind of a landing page. It's fns.usda.gov/OBBB. And that has all of their guidance for states there on a landing page for these different pieces around SNAP. Also wanted to share, and I'll be referencing this document a bit in a few slides and showing a few pieces from this document, but the Iowa Department of Health and Human Services does have a document about the federal reconciliation bill and its impacts to SNAP and Medicaid in Iowa. That's available on their government relations page. And I'll try to get these links posted in the chat, or if anyone else is able to do that, that would be great. But you can find more directly there, both from USDA and HHS. Okay, so some of the immediate impacts. One of the big changes in this bill is around the 3-month time limit or work reporting requirements. If you've been on previous calls, you may have heard us talk about the ABOD time limit or work reporting requirements. It's kind of complicated. I won't spend too much time here. The, I guess, short version is work requirements already existed for SNAP for people between 18 and 54. And basically, if you're not working 80 hours a month, or participating in a training program or education, you can only get SNAP for 3 months every 3 years. And the idea is if someone's out of work, that gives them time to find employment. But we know that this can be a barrier, even for folks who are working to meet that requirement, or folks who have trouble claiming an exemption from it. So this expands that work requirement. This bill expanded that work requirement to individuals ages 55 to 64, parents and caregivers of children ages 14 up. That means if they have a child younger than that in the household, they are still exempt. But if dependents in their households are ages 14 and up, this work requirement now applies to them. There was a previous exemption for veterans, homeless people, and young adults aging out of foster care. That exemption was removed. So those folks are also going to have to start complying with this. You may have seen some national reporting about work requirements already going into effect. This is, again, kind of in the weeds. Some states have a waiver to not have this in place. Iowa doesn't have that waiver. So that was not a change for us. USDA's guidance is very confusing here about an effective date. Basically, the letter they sent said all of these changes were effective upon enactment, which this was signed on July 4th, these pieces. But it said we're giving states 120 days, basically, to comply. If you work out 120 days from July 4th, that is November 1st. But they have not clearly stated this is going into effect November 1st. So it's a little unclear. When I asked HHS, they said we're complying with the USDA guidance about their 120-day grace period. So my interpretation, there's an asterisk here because it's not confirmed. My interpretation is that means November 1st, these are going to be going into place. And we'll be sure to update you if that changes or if USDA puts out additional guidance. And so one thing, I'm going to stop sharing here in just a second, but I wanted us all to be thinking about when this change is coming. How can we all in our communities as community partners be thinking about helping folks who are currently on SNAP, who are going to be now subject to this requirement? How can we help them meet that requirement or claim an exemption if they should be exempt? Or if they lose their benefits and they feel like they shouldn't have, how can we help them point them in the right direction to appeal a wrongful denial? So I know there's a lot in this question, but I guess just thinking about how can we all respond to this change? And so I'm going to stop sharing. And if folks want to post in the chat, feel free. If you want to raise your hand, come off mute. Yeah, I will just open it up.
I'm wondering, Luke, if it might be helpful just to at least have something that could be posted in some of our locations saying, essentially, here are your rights to appeal, or here's how you can comply, and here's how you can appeal.
Yeah, that's a great thought, Tom. I know Iowa legal aid is understaffed and overworked probably, but they do help with appeals. And so being able to point people in the right direction. And I like the idea of, a flyer or something that we can post that's very plain language about the changes that are coming. I know that's something we did a couple years back when there was a change to that age requirement and even ran it past HHS to make sure it was accurate. So I think that's absolutely something we can put together and distribute. So yeah, great idea. I will also just share, we don't know the specifics of how this guideline is going to need to be met, but if people are able to fill this requirement with a volunteer opportunity, thinking about if there are ways that we can help people meet that requirement through our own organizations. If someone didn't get enough hours at work that month and they're going to fall short, can we provide them, with a volunteer opportunity that's going to help meet that requirement or things like that? Again, we don't know the specifics. We don't know um, how that would be tracked or anything, but it's something for you all to be thinking about at your organizations and something we're going to be exploring. And Mary, yeah, I see your comment too, similar to Tom's of just informing people about these changes. I think that's going to be a big piece of this, so they're not finding out with a letter in the mail.
Hey Luke, Jan here.
Yeah.
We're just talking about not only the education, but also just the technical support to fill out the forms and as you say, to process that. Seems to me there's a bit of a maybe agency capacity, but is there some like training to help expand that into small volunteer organizations that are already working on food access? I don't know what's involved or how complicated all that stuff is.
Dan, you are reading my mind. I actually had a conversation with someone at HHS yesterday about this implementation and things that are coming. And, you know, something we've been talking about at DMARC, where I work, is how can we help folks, in filling out applications and helping them with their recertification documents, things like that. And I think HHS has indicated that they're open to, help run trainings for community groups on application assistance. It's also something I've been talking with the SNAP hotline folks about because that's something they do. So I do think we will have some opportunities and some help from Iowa HHS and running trainings for community groups. I think that is definitely going to be an opportunity in the coming months. So very glad that you brought that up. Thanks. And I see a question, and I feel like we lost Jan there. I will make sure I follow up with her if she's not able to rejoin. I see a question from maybe she just turned off video. Never mind. I see a question from Carmen about, do we know how many hours are required? Yes, we do. It will be 80 hours a month for the folks that have to meet that. So it can be, I mean, on average, that's 20 hours a week. But they actually do it by the month. So if you have more hours at one point, and less later in the month, as long as it works out to 80, you can do that. I can post the SNAP hotline number. I actually can't minimize right now while I'm recording, but if someone else wants to find that, or I can post that once the meeting is kind of done and we've stopped the recording, I can post that in the chat too. The SNAP hotlines operated by Food Bank for the Heartland, and they kind of operate SNAP outreach, and the Iowa Food Bank Association as well. So, all right, any other questions on those work requirements or thoughts on how we can be preparing to respond? Right, I am going to move on to another kind of immediate impact, and this is not as huge of a change. There were two changes to the utility deductions, which when folks are filling out a SNAP application, you share information about your income, you also share information about your expenses, and you can claim deductions that then can help increase your household benefit amount. There's going to be a change coming where uh, households who participate in LIHEAP, which is the low income heating energy assistance program. I think I probably got that wrong. Apologies. So LIHEAP households will no longer automatically qualify to receive the big standard utility allowance unless they have a senior or person with a disability in their household. They can still qualify. They're going to need to prove some additional things. This essentially is a change from current policy that is going to, for some households, increase the amount of paperwork for the agency, increase the amount of paperwork for the household, and could result in some folks losing benefits, seeing their household benefits reduced if they're no longer able to claim that allowance. The second piece is around internet expenses for utility deductions. This was a change that was forthcoming under the Biden administration that basically got undone. And so this does not impact, it's not a change from current policy, but it effectively reduces future benefit amounts. Starting next month, states were going to be able to allow folks to deduct their internet expenses as a utility. They're not allowed to do that anymore. So again, it's not a change from current policy, but it does impact future benefits that folks would have been able to get. Another immediate impact is the defunding of SNAP Ed. I think a lot of folks are aware, but the SNAP Ed nutrition education program was essentially defunded through the reconciliation bill. This funds a number of programs and positions at Iowa HHS and Iowa State University Extension and Outreach. USDA did issue a memo saying that states could spend any remaining SNAP Ed funds in fiscal year 26. But we do know that there are multiple extension employees who are funded through SNAP Ed whose last day is September 30th. We don't know if the state is using any of those rollover SNAP Ed funds for any other purposes. But we do know that this is impacting, program and personnel already. So I have another kind of question for the group. Thinking about if you've worked with, SNAP Ed in your community, what resources are we losing across the state right now in your own community? And how can we try to fill those gaps? I mean, I know that we're not going to be able to fully fill those. But just thinking about how we as community partners, organizations, individuals can think about those gaps that are going to exist now. Does anyone want to maybe share an example of the work that SNAP-Ed has done in their own community? If you know, I mean, sometimes people aren't even aware things are funded through SNAP-Ed, so it's not always clear. can share again. It's fine if we don't have a talkative bunch this morning. That's fine. I know at DMARC, we worked with a healthy food access specialist through Iowa State Extension and Outreach over the years, to do nutrition classes, nutrition education for food pantry visitors and for our volunteers, training them on how to talk with folks coming through the food pantry. We've relied a lot on Spend Smart, Eat Smart, their website of recipes, and different kind of food prep videos and things like that. So, I think it's going to be a huge loss. And I don't know necessarily that there are going to be resources that are stepping in. So again, something to think about in your own community of what is that loss of SNAP Ed going to look like? And how can you be thinking about nutrition education and some of these other pieces that SNAP Ed was, really effective at doing? All right, I'm going to share again. Another really, really disappointing piece in the reconciliation bill was around non-citizen eligibility. Essentially, the reconciliation bill eliminated SNAP eligibility for refugees, asylees, and certain other immigrants here on humanitarian grounds. We don't know exactly how many people this is going to impact in the state of Iowa. The last number I saw was from a few years ago, and it was 4,000. But we know that a lot of the times refugee families tend to be larger. This is probably going to be, a loss of hundreds of dollars of benefits for the families that this is going to impact. USDA has still not released any guidance. It's unclear if this is going to be effective November 1st. If you're interpreting their letter, as I kind of explained earlier, or if this could be a little bit further down the line. And um, we also don't know, depending on how USDA issues guidance, is this going to be something where the state's going to have to check on a certain date and remove anyone who is not, or is it going to be something where as people hit their recertification periods, they're cycled off? We don't know yet. And I think that will probably change when this impact occurs. But I tried to include some participatory questions, which we can skip over if people aren't feeling talkative. But another thing I want us all to be thinking about, at least, is how we can support refugees and other non-citizens losing SNAP. Because again, this is going to be a potentially big hit to household budgets. And we also know that food pantries and other food access organizations don't always have the food to, meet the dietary needs of every culture of people in their community. So I guess I will start and say we're thinking about, if we see folks in our community lose SNAP benefits, how can we partner with, you know, certain community groups who work specifically with refugee populations to understand, how many households are maybe losing benefits or are going to be in need, what types of foods are they looking for, and can we do specific food drives working with those organizations, um, to gather food from the community, that those households are going to, actually use. So that is something to be thinking about, but also open to other ideas. I think really now is the time to be reaching out to those groups. If they're not aware of this change coming, I'm sure most of them are. Um, but just trying to understand their perspective as well. Uh, yeah. Any other thoughts or questions there? I'm just reading your comment, Catherine. Thank you for sharing. I'm sorry to hear that. Yeah, I see in the chat community fridges or gardens. Um, we know access to growing spaces is a huge thing. And so that's something communities can be thinking about, making community gardens more available. And yeah, community fridges. If there's a mutual aid group in your area, could they think about a dedicated fund for refugee families during this time? All great ideas. And again, as we know more of a specific date, we will be sure to let you all know. I don't know if it is going to be November 1st or if it's going to be a date after that. I don't anticipate it will be sooner. All right. So now looking ahead at the upcoming state legislative session, one of the big changes to SNAP in this bill was around cost sharing for states. Currently, right now, states cover 50% of the administrative costs for SNAP, and the federal government covers 100% of the benefits. Both of those things are changing. So for the administrative cost share, starting in the federal fiscal year 2027, which starts next October 2026, all states will be responsible for 75% of the administrative cost share, up from 50%. So it's shifting from 50-50 to 75-25, starting in basically a year. So this is going to be an additional 13 to 15 million dollars that the state of Iowa is going to need to come up with every year just to fill that administrative cost share gap. And I also want to note this also impacts the funding share for SNAP outreach. I mentioned the SNAP hotline earlier. SNAP outreach in our state is actually privately funded through the Iowa Food Bank Association. They get grant money from private funders to get the federal match for SNAP outreach. The state actually is not paying that cost share. So right now, the Iowa Food Bank Association is paying 50% of the administrative cost share, and the federal government's paying 50% for SNAP outreach, which is the SNAP hotline, SNAP outreach workers. That is also going to be impacted. So Food Bank Association is going to need to cover 75%. That looks like $125,000 a year additionally. And I'm not sure how they are thinking about that. But there is a funding threat there as well. Again, the state doesn't put any money toward this. That might be an opportunity if our state wants to invest additional dollars in SNAP outreach. Seems like we've seen people wanting enrollment to trend the other way by certain lawmakers, but I don't know. Maybe we might have an opportunity there. And I want to know any investments made before September 30, 2026 are still eligible for that 50% match. And so if our Department of Health and Human Services is asking for investments in things like an IT upgrade, now this coming legislative session is going to be the absolute best time to do it because it's going to cost less and the investments that we make are going to help bring down the payment error rate in the future. Which brings me to the state benefit cost share. This is the other piece of this. States are now going to be on the hook potentially for some of the cost of the actual SNAP benefit amounts in their state. And they made it more confusing than they probably needed to. And they tied this to the state's payment error rate for SNAP. The payment error rate measures both underpayments and overpayments. SNAP has a very robust quality control system. So when I sign up for SNAP, I'm signing my name. I am basically saying I will cooperate with an audit. And USDA, with partners at the state of Iowa and HHS, conducts these audits every year of SNAP households to see were folks actually eligible? Did they get the benefit amounts they should have? And they produce a few metrics from that. And one of them is the payment error rate. It measures, again, both underpayments and overpayments. It tends to be more overpayments, but it does include underpayments. And I want to be clear, this is not program fraud. These are unintentional mistakes made by either the agency or the household. Actually, in Iowa, quite a few of them are made by our agency still. And so these are inadvertent errors. But this payment error rate is what the feds are using to calculate how much our state is going to need to cover of that SNAP cost. If we stay under that 6%, we don't have to pay anything for benefits. So that is the goal. If we go over that, there's penalties. This means we could be required to pay anywhere from $0 a year to $77 million a year, depending on how our payment error rate looks, which means our HHS department is going to be laser focused on this payment error rate. And I'll mention I'm not a Medicaid expert, but there are pieces around the payment error rate for Medicaid also in this bill. And so both, I think, for Medicaid and SNAP, they're going to be highly focused on payment accuracy because there's huge implications to our state budget. This is from that document that is on the state's government resources website. So essentially, this means that we have until basically a year from now to get our payment error rate below 6% to avoid multi-million-dollar implications. We have the choice to either use our fiscal year 25 or 26 payment error rate for the 27 cost share. I know this is a lot of acronyms and numbers, and I'm sorry. But HHS put out this in part of their document. They actually shared, here was our total SNAP allotment in past years. Here was our error rate. Here's what the cost share would have been. And you can see this past year, fiscal year 2024, our error rate was 6.14. We were just above that 6%. But if this had been in place, that would have cost the state almost $27 million. So again, that just small percentage of a point, you can see the year before we were at 5.19 would have cost us nothing. So the goal here is to be below 6%. And you can see here at the bottom on HHS's own document that their projected SNAP error rate for fiscal year 25 is 5.9%, which for me is a little too close for comfort, but I'm glad to see that we're trending just below it. We have a whole blog post that I can send along about the history of the payment error rate in Iowa and some of these other pieces. You can see we've been a lot higher in the past. It's come down. We were just at that 6.1. I'm really hopeful USDA or HHS can keep it below that 6%. This is also from their document. And I think this is from the last page of that document. And I think we as advocates really need to focus on this messaging. This is the messaging that HHS is going to be using with the legislature, talking about how IT investments reduce payment error rates down the road. And again, if we can invest money now, that is going to save money in the future. And it's cheaper to invest in the next, this coming session than a year later, just because of the cost share. I anticipate we'll see an ask from HHS around an IT investment, and I think we should be prepared to really support that. Unless there's bad pieces included in the bill around reducing accessibility, it's going to be really important for HHS to have the resources they need to get this payment error rate under control, or we could see massive cuts to SNAP and other programs in the future. So this may be a legislative session where we as advocates really want to be lifting up the work that HHS is doing and making the case with our legislators to have investments, which I feel funny saying, just because a lot of the times, um, we haven't always seen eye to eye with HHS on things. But this is an area that I think is going to be really important for all of us to really be seen as a strong ally. So again, I encourage you to look at that. And I kind of led into this already, but really be thinking about, I think, as you're thinking about whether you have a legislative agenda for your group or not, if you engage in advocacy, if you are talking with legislators leading up to the session, plant the seed. Talk about this payment error rate and how this session is going to be really pivotal to invest in HHS to make sure we can get this payment error rate below 6% to avoid those huge multi-million-dollar penalties in the future. So does anyone have questions or thoughts on that as well?
Luke, where is Iowa Hunger Coalition in setting its legislative priorities for the 26th session?
Our policy committee is meeting this Friday at 1 p.m. And if you would like to join, please shoot an email to iowahungercoalition@gmail.com. But we are having kind of a final meeting about our legislative priorities as a policy committee. And then as a reminder, that policy agenda will go out to all IHC members, basically for approval and feedback. So if you are a paid member, you'll be hearing from us soon about that policy agenda. What I was just talking about, I anticipate some of that will be on our policy agenda, but we're also focused on other things too. Double up food bucks, summer EBT. We're not losing sight of those, but we also realize there's going to be some really big fish to fry this coming legislative session in terms of SNAP funding. So we're not losing sight of those, but also just recognizing priorities and everything that's coming from this reconciliation bill.
Yep. Thank you.
But yes, I will plug that too. If you want to be part of that meeting, you do not have to be a dues paying member to to join the policy committee. So let me know. I will put the Iowa Hunger Coalition email in the chat here. And I also saw a great question by Erica. Are school lunches, free and reduced lunches, affected by SNAP qualification? And the answer to that is yes. When people qualify for SNAP or Medicaid, there is direct certification in the state. And I'm not exactly sure how this works. I think school districts basically get a list every month from the state of households that should be directly certified. And so, school nutrition directors on the call, please correct me if I'm wrong here. But they get that information from the state every month. And those, if you qualify for SNAP or Medicaid, you automatically qualify for free school meals. And so this bill, this reconciliation bill, did not directly make any changes to school, eligibility for reduced or free meals. It didn't make changes to the community eligibility provision, which an initial version had, and we were really worried about. And there was also this proposed change that they were like, school districts were going to have to verify income for everyone, which was going to be a huge change. I think we got to keep those on our radar for future bills, but those were not included in the reconciliation bill. You're right, Erica, though, this is going to be devastating because if households lose access to Medicaid or SNAP, that doesn't mean that they're automatically going to have to pay full price, but they're not automatically going to qualify for free or reduced. So they're going to have to fill out an application to see if they still qualify for those school meals. And again, it's going to add more paperwork for the schools. It's going to add more confusion for households if they just automatically qualified before and suddenly don't even realize why they lost access. Um, and yes, yeah, Tom, you're exactly right. They'll still qualify, but they are going to have to fill something out. Um, the basically you're eligible for free at 130%, eligible for reduced between 130 and 185. So a lot of those households may still qualify. They'll just need to fill out more paperwork. Any other questions there? All right, I'm going to go back to sharing my screen. Just a reminder, this is a blog post we put out just with some projections for the state of Iowa. Iowa's facing a $1 billion loss over the next decade due to these SNAP cuts. And that, I want to be clear, is if we don't have to pay a single cent of the benefit cost share. If we do, that number is much, much bigger. And so this is a kind of graph that outlines those cuts and where they're coming from. And you can see those benefit cost share bars at the bottom there in gray. Again, that was not included as part of the 1 billion. I think it'd be like 1.7 or 8 billion if we were at the 15% every year. And so again, there's just huge implications for the state's budget, and with that, access to programs around this payment error rate. And again, I think this coming legislative session is going to be very consequential around HHS budget. Kind of already went over questions, but if there's any other questions, feel free to come off mute or post them in the chat. All right, I have a quick state policy update, but again, it's a lot of we don't really have any updates. But just a reminder, the state's SNAP waiver request is set to take effect January 1st, 2026. This restricts any foods that are subject to the sales tax will not be eligible for SNAP. So that's things like soda and candy, but there's also some weird things around, granola bars have to have flour or they're considered a taxable item. There's a list you can find online. Um, Iowa must have 4 final plans approved by USDA prior to implementing the waiver. We don't know the status of these. I'm assuming they have not yet been approved by USDA. And Iowa was also planning on using some SNAP Ed funds to conduct part of its evaluation plan. So we don't know, are they using some of those rollover funds for this? Are they finding another funding source? We just do not know that piece. Any questions about the waiver? That I probably won't be able to answer anyway.
Now, Luke, this kind of goes back to our earlier thing about how we're going to help people navigate all this, but what kind of like education and promotional stuff there's currently signage like at grocery stores and places where folks are buying food. So is there anything in the pipeline that we know is coming around these kinds of updates from agencies?
Yeah, so I kind of glossed over it in that slide, but Iowa needs to submit 4 different plans to USDA before they can implement this waiver. And one of them is basically a communications plan for alerting consumers about this change. Another plan is alerting retailers about the change and giving guidance to retailers. But they are supposed to come up with a plan for informing SNAP households of this change. Now, I don't know if that looks like one single mailer, which probably won't do it, or store signage, things like that. I will say it's something we are thinking about as the Hunger Coalition of how do we let folks know about the impending changes. But honestly, we've been waiting to see what the state is doing. We don't want to step on their toes, if with any official notices. So we may need to fill in some gaps with a poster or something and are prepared to do that. But are kind of waiting to see what Iowa HHS does with their communications plan.
Thank you.
Yeah, and I mean, I would guess I will just add the department has a lot on their plate right now. With all these changes from reconciliation, and then you add in this waiver, and then you add in Healthy Kids Iowa. I think they are probably stretched very thin right now.
Yeah, there are a number of folks on here from, other food access organizations and public health, and it just feels like this boulder is coming at us, and 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 I think maybe we're all absorbing some of this and thinking about it internally as to like, okay, so how do we position it? But it feels to me like another conversation in a month, is that is that too far out for us to really digest and understand what we are collectively doing? I don't know how we can, and maybe there's something that IHC is already doing that I'm just missing, where people are sort of keeping each other up to date. This is what we're doing over here. This is what we're doing over here. Here's what's come down from HHS. So here's a new opportunity. I don't know. There's so much on so many levels, but it just feels a little urgent. Everything feels urgent. And
Mhm.
um, I'm curious what your thoughts are, what the collective thoughts are about how we keep each other connected.
I have some thoughts, but I am curious to hear if others do as well. First, I will share if you're not already signed up for IHC's email newsletter, encourage you to do that. Part of the struggle here, Jan, is yes, it does feel like a boulder coming, and USDA and HHS have issued very little information about what is coming. So that is a difficult part of it. The other thing I was going to share is, in addition to IHC's email newsletter, well, it's not an IHC thing, I guess, but just there's basically a listserv for SNAP advocates in the state. And that is sharing probably things that are a little more in the weeds and during the legislative session, information about bills and things like that. If you like getting a lot of emails about SNAP stuff, we can certainly get you added to that, because I will say we tend to share more information there than what is going out in the IHC newsletter, or at least in a more timely way. And then another thing I will mention, also, again, not something that IHC is doing, but I know there were some calls with like partner sites for Healthy Kids Iowa, and I think some of those calls are going to be continuing, um, to just provide more of like a resource sharing space for food pantries and food access organizations. So I don't have any information on that, but I can try to learn some and send that along to Jan. So I think some of these conversations are happening, but it's also we don't even know when and how this is going to impact the state yet.
All right, thank you. We're all kind of operating from the same place.
Yeah, I don't have any secret knowledge. I'm sorry. All right, I did not have any other updates. Does anyone have any questions at all? And Jan, I think it's a really good idea to maybe even have one of our future meetups talking about these restrictions that are coming and more information and idea sharing. So maybe that's something we can think about for October or November. Caitlin, I did not talk about the Maha strategy if you want to come off mute.
Give me just 1 second. I'm transitioning to my computer.
I'm sorry, I didn't mean to put you on the spot. Yes, you may have seen there was like a Maha report that came out. Um, and in the context, I think of this SNAP waiver, something to know is I think it's likely we will see movement on the national level for a nationwide SNAP restrictions. I heard on a call yesterday that USDA may be looking at essentially making that change by doing a proposed rule to the list of qualifying foods and beverages. So it would be through the rulemaking process. There would be an opportunity for people to submit public comment and everything. That's just a rumor I heard yesterday. But this Maha strategy document also made a reference to nationwide looking at, or at least support for these pilots in other states. So yes, this is something we'll be dealing with in Iowa. There are a number of other states dealing with it too. We could see a nationwide restriction, and actually there's a chance we could see a nationwide restriction that would be less restrictive than Iowa's. Um, but yeah, Caitlin, is there anything else you wanted to add on that Maha document if you are able?
Um, yeah, I think it's just really interesting. I haven't dived into it too deep, but I know there are things I looked around for like things related to school meals. So there are some things there. It talks about updating the dietary guidelines, um, things about ultra processed foods, food dyes, those types of things that we've been hearing a lot from the Baja movement. So yeah, it is kind of interesting. There's some like environmental things in there around like um, forever chemicals, vaccines. I mean, it's quite a lot of things in it, but nothing is overly specific, which is also interesting. It's like vague but specific.
Yeah, I
Um,
think there was another reference to the Maha Box program we've heard referenced a
yes.
couple times. I think in Trump's budget, the commodity supplemental food box program was like zeroed out and then replaced with the Maha program, which had very little information, and this also had very little information. During Trump's first term, there was a proposal to replace, basically give people less total SNAP benefits and replace some of their benefits with a box, a predetermined box. And it seems like that idea may be resurfacing, whether it is through SNAP or through a commodity supplemental or some other box program, this sort of Maha box. Now, I would hope that they would purchase directly from local farmers and get all the best, most nutritious foods. But with some of the box stuff we saw, like some corporate fraud happening, not in Iowa. I think Iowa actually did a good job with the pandemic boxes, but nationwide we saw it not work always in the best way. So, but again, very little details about that box. So,
Yeah, it also says USDA will use its authorities to prioritize utilization and promotion of whole healthy foods across its 16 nutrition programs, which again, super vague and not clear as to what that means. I mean, with them saying that they're gonna make a definition for ultra processed foods and remove food dyes and additives in foods. Like it's like probably something in that direction is what they consider whole healthy foods. So yeah, I think this is really, it's interesting, and it will be interesting to see how like things trickle down from it. So
Yeah,
Totally
thank you.
different topic, but I see that the USDA is going to reinstate the farm to school program. Do we have a timeline on that? And do we know if it's also going to include the LFPA?
So the farm to school, the Patrick Leahy farm to school grant application is open. So like the RFA is out there for schools and agencies to apply. It is a pretty broad group of people who are eligible. So it's like nonprofits, schools, tribal organizations, like there's this whole list of like eligible entities for the grants. They are like the past farm to school grants where only like 10% of your budget can be spent on food. And it can't be part of a meal. So it has to be for like taste testing or nutrition education or things like that. And that's completely separate from LFS and the local food purchasing programs that were in the past administration. So yeah, unfortunately, I wish LFS was coming back, although there is a bill at the federal level for I can't remember, it's like the Strengthening Local Foods Act or something along those lines. And that is a bill to like essentially reinstate LFS. And I don't know if it's LFPA too, but maybe. So
Yeah, thank you for sharing that, Caitlin. We
mhm.
should send something out about that. You can contact your member of Congress and ask them to co-sponsor. I believe Representative Zach Nunn is a co-sponsor. I will find some more information and we can send that out because that's great point, Caitlin.
Mhm.
But yeah, it's not LFS. It's a competitive grant. It's not, like Caitlin said, like going to be used to purchase a bunch. I think it's more like infrastructure and capacity building stuff. Am I wrong, or is it?
Yes, the farm to school grants are a little bit more focused on like building infrastructure, putting in school gardens, building capacity within organizations to do farm to school programming. So it is a little bit more like programming focused. It's not really around procurement or purchasing. So, and the minimum award is now $100,000 for the minimum. So they said with their goal with it is to promote like cross-agency partnerships and collaboration. But I think really what it probably ends up doing is deterring like a single school district from applying for
Mhm.
a grant and being able to do some really great work. So
Yeah,
while I love the idea of cross collaboration and partnering and doing all these larger scale projects, like it does take away the opportunity for smaller types of projects to happen with more local impact. So good and
yeah,
bad. So
yeah. But it was nice, having one program that was frozen actually come back.
right.
Um, so yeah.
Yeah.
Any other questions? Otherwise, I think we'll get wrapped up. It's right at the hour. So thank you all for being here. Yeah, just a reminder, we do this every month, third Wednesday at 10 a.m. Sign up for our email newsletter. And please feel free to reach out at any time, iowahungercoalition@gmail.com with any questions or thoughts. So thanks all. See ya.